What we've got is a clinically designed building of 5 floors, 48 critical care beds, and there'll be critical care beds from all sorts of level, so intensive care, high dependency, and some enhanced care to improve the length of stay of patients when they're in hospital. This new unit has all the state-of-the-art equipment. Every single bit is new. We're barely taking anything from our old unit. We've bought exactly what is needed and it'll be in the correct place. The process of working for staff will be so much more staff patient focused. We are aiming to keep staff at the bedside where they should be. The environment will be a good place to work, very good place to work, because we've all got the same aim and now we're given the facilities. But what this is doing is it's an extra environmental tool that allows the amazing clinical staff to do their role. So there's beautiful daylight, there's natural light coming in, there's a view from most of the windows. The patient will always be able to view a nurse within sight, and that must be reassuring. If you're lying in bed extremely ill, you don't feel alone, you don't feel frightened, you will always see a member of the staff. Applying to this new unit would be a fantastic idea. If you're even contemplating ICU, or you already work in ICU or HDU, critical care of any sort, give it a go. It was the best move I've ever made. I've taken all my experiences and all my wishes from all my career in critical care and added it to this unit. So I'm hoping that for the worker, it will be a really good, suitable, comfortable place to work.